Mainly, there are four categories of snake which are poisonous in India. The most common being the cobra, Naja naja. Then we have the common krait, Bungarus caeruleus. Then we have the Russell's viper and we have the saw-scaled viper. Now, the common cobra is also called Naja naja. The common krait is not much long. It is black in color. It is having white strips on its body. It is up to 3 to 4 feet and the fatal dose is 6 milligram. The Russell's viper is very easy to recognize. We can recognize it by the 3 rows of diamond shaped scales. The body of snake will be like this and it will have 1 row in middle and 2 on the either sides. You can easily see in this image the diamond shaped scales. This 1 row, then we have this another and this is another. So these are the 3 rows in case of Russell's viper, and this is the saw-scaled viper. These are the 4 venomous snakes which are commonly found in India. Now we will move towards the management. What mainly people do, they will at the site of the bite of snake, they will do the suction, they will cut that site and they will allow the blood to flow, but that is not the good way in order to deal with the snake bite. So the first aid I will tell you in this how to manage the first aid. So carry the victim, do not allow them to walk. So we have to carry the person who is having snake bite and do not allow them to walk. So what will happen if we do not allow them to walk? So the circulation will be slow and the venom will not spread fastly. So do not make use of tourniquet, because if you tie the tourniquet, the circulation will be disturbed and it may have various side effects. Do not cut and no suction. So no cutting must be there, no suction. Do not try to suck the blood. Okay, then reassure the patient. See, in India, whenever a person gets snake bite, it is not necessary that the snake which has bitten the person, it is venomous snake. Many times the non-venomous snakes also bite. So in that case, even though the snake is non-venomous, but the patient may die due to heart attack or other reasons. So we have to reassure the patient that it may be the non-venomous snake like this, and we have to calm down the person. We have to reassure the patient. Now the best is get hospitalized, take them to the hospital, tell the doctor about the symptoms whatever you have seen in that patient. Now the Sutherland wrap, as you can see in this image, this is the Sutherland's wrap. The bandage is tied firmly from the toe up to the leg completely. It is tied firmly but not so tightly that the circulation is stopped. Okay, so what are the mainly we'll study this about the Sutherland wrap. So bandaging is done. A firm elastic bandage is wrapped tightly around the bitten limb, starting from the fingers or toes and working upwards. The bandage should be snug enough to feel a slight pressure but not so tight that it cuts off the circulation. So we must not cut off the circulation, just in order to apply slight pressure, and it helps in immobilization. The limb is immobilized to prevent movement. We have to make use of lint, sling, or slightly encouraging the person to remain still. So this will cause the slowdown of the spread of venom. And then we have to record the time of bite and at what time we are applying the bandage, so that we can tell it to the doctor. Then the location of bite we have to mark. So see, if here is the snake bite, we have to mark the, so that we can easily it will not be difficult to later find where is the bite. Okay, then the location of the bite we have to mark. Then why is it important? So slow venom spread, it slows the venom spread. because by immobilizing the limb and applying the slight pressure, the Sutherland swab helps to slow down the absorption and the spread of the venom into the bloodstream. Also, the spread will slow down, also the absorption will slow down, and it will minimize the systemic effects. And this will help to reduce the severity of systemic effects like the swelling, pain, and other complications. It will provide time for medical care. Okay, it provides time for the individual to reach a medical facility where antivenom can be administered. Okay, so this is the best way we have seen the management of the snake bite. First aid. So what you will do, you will carry the person, you will tie the bandage has to be tied by using slit, and we have to tell the person not to mobilize the limb. Do not apply the tourniquet at the site, so that do not apply too much pressure, and also do not cut that side and do not suck that side. Okay, because that is not at all the useful way. Okay, and take the patient to hospital and get hospitalized. Okay, also tell the doctor about the symptoms and the site where it has been. The time we have to calculate that it's about half hour that the snake bite has been happened, like this. So it will help the doctor to know the severity. Okay, then we'll see the specific treatment. Now, what is the specific treatment? The polyvalent anti-snake venom, PASV, polyvalent anti-snake venom, is the specific treatment. It is actually made by the using the horse serum, and it is having the anti-snake venom for big four categories of snakes, which are mainly found in India. As I have told you, they are the Naja common cobra, then the common crate, then Russell's viper, and sawcell viper. So these four are used to make the polyvalent anti-snake venom using the horse serum. Okay, then we can also use IV neostigmine and atropine. This is for neuromuscular palsy. Okay, and the supportive measures are taken, like in order to treat the local necrosis, treat the renal failure, we can give the supportive measures. The polyvalent anti-snake venom is hyperimmunized horse serum. It is administered only if signs of envenomation is present. Okay, if there are no signs of envenomation, poisonous snake envenomation, then we do not give the polyvalent anti-snake venom. Only if signs of envenomation is seen, then we give polyvalent anti-snake venom. Polyvalent anti-snake venom neutralizes the circulating venom only, effective against venom of big four species. Then the dose is 10 vials intravenously, and no test dose or dose adjustment is required in this case. Then the IV neostigmine and atropine is given for neuromuscular palsy following the cobra bite. And the supportive measures. These are the specific treatment which are given in case of snake bite by the doctor. And these are the preventive. So thank you.